Dr. Sharon Vincent, and I will be taking you through question paper discussions related to Pedodontics and Preventive Dentistry, Kerala University of Health Sciences. So, child psychology is one of the most important topics of pediatric dentistry, and you can for sure expect one question from this topic, either as a long essay question or as short notes. So I have enlisted questions from previous year's question paper. So let's discuss each question in detail. That is how you should present your answer and key points for better score. So under this topic, you can expect questions from emotional development, that is cry, fear, anxiety, the different theories of child psychology, and behavior management, that is non-pharmacological and pharmacological methods. So emotional development, the questions have come on dental fear and anxiety mainly, but you can also expect questions on different types of cries, that is obstinate cry, frightened cry, and hurt cry and compensatory cry. All this chapter is very well given in Shobha Tandon. I have picked it up from the 3rd edition, first volume, and page 205. Now coming on to dental fear and anxiety, certain terms are very important in pediatric dentistry for you to score better marks. So whenever, whatever terms I am telling you, do make sure that you highlight those terms, which will definitely catch the examiner's attention, and that will help for better score. So when you write an answer on fear, you need to write the definition of fear and definition of anxiety, and you need to highlight this, that fear is the reaction to known danger and anxiety is the reaction to unknown danger. So the fear of dental situation, that is, it can be innate fear, objective fear, or subjective fear. Now you need to write the value of fear. Fear has to be channelized into dental practice. We never try to eliminate dental fear, because that decreases the, we need to have the correct pain threshold, okay, that acts as a negative feedback for us. So, and that is a protective mechanism from patients. So that is the value of dental fear. Now, also fear can be utilized as a method of punishment also, okay. So that is why we say we always channelize the fear into right direction. Now, what are the most common fear-evoking dental stimuli? It is related to administration of the local anesthetic, the extraction, and sound of eroder. These are the most common fear-evoking dental stimuli. Now, anxiety. What are the subtypes of anxiety? That is related to association of previous experiences, attribution, that is, some people are biologically more anxious than other people, and appraisal, that is anxiety because of the negative thinking. Now, what are the causes? Causes can be because of uncertainty, because of previous experiences, and biological differences between individuals. Now, types of anxiety can be trait anxiety, state anxiety, free-floating, situational, and general anxiety. This is again very well given in Shobha Tandon. Please refer the book for same. And you have to write in brief about the anxiety rating scales. That is, it can be verbal and or pictorial representation. Now, first dental visit. This is given as a separate chapter in Shobha Tandon. Also, it is given in Nikhil Mava. You can refer any book for this. So, when you write an answer on the first dental visit, you must elaborate on the importance and timing of the first dental visit. That is, it should be as soon as the first tooth erupts or no later than the first birthday. Okay. Then you need to write about the concept of dental home. Draw the periodontic treatment triangle where the child is at the apex of the triangle. How the ambience of the dental clinic should be. It should be welcoming and playful, and what colors should be used in setting up of a dental clinic for pediatric purpose. What are the different methods of reducing fear? That starts from the reception itself, okay. How you should communicate to the child, how to approach children, and what methods of behavior management we should treat while we interact with the child. Okay, so this answer will be a combination of all the factors that I mentioned. So for desensitization, you will have to practice tell, show, do, modeling, euphemism and reinforcement. Now next, a very important topic under this is theories of child psychology. So each and every theory of child psychology is very, very important. It can come as a long question. The short, some few terms can come as short essays also. So let's discuss these theories one by one. Now this classification is very important. Again, I picked it up from Shobha Tunnel. So that is psychodynamic theory, which includes the psychosexual theory or psychoanalytical theory by Sigmund Freud, psychosocial theory or Erikson's theory, cognitive theory. Now, if possible, it will be great if you remember the year in which this theory is given. Obviously, the name of the author has to be written. Now, theories of learning and development of behavior, that is classical conditioning theory by Pavlov, operant conditioning by Skinner, and social or observational learning theory by Bandura. Hierarchy of needs by Maslow, and Margaret Malloy's theory of development. Now, whenever you write these theories, you need to write about their dental applications, because further we will see that some techniques of behavior management are actually based on these theories. So how you can apply it in your dental clinic, that has to be definitely written when you write an answer on these theories. Now first is the psychoanalytical theory that was given by Sigmund Freud. Sigmund Freud's theory is not only stages of development, it includes all these, that is the topographic model, the psychic model or the psychic triad, and the stages of development. And whenever you write any theory, do write their merits and demerits as well. These are also very well given in Shobha. Now first is the topographic model, in which you need to write about the iceberg phenomena, draw this diagram. Okay, that is the conscious, subconscious and the unconscious level. Now psychic triad, highlight these terms, that is, it is based on pleasure principle, ego is based on reality principle, and superego is a combination of these. Now ego defense mechanism is again a frequently asked question. So it is nothing but in a stressful situation, how a person reacts will be based on which character or of the trait is dominant in that person. Okay, whether it is id, ego or superego. So the combination of these factors will define the behavior of a person in a stressful situation. So ego defense mechanism can be projected in the following ways, that is displacement, projection, reaction formation, regression, repression, rationalization, denial and identification. Now we come to Sigmund Freud's stages of development. So this table is given in Shobha Tandon, and whenever you write these stages of development, you need to write these that is introduction, characters, objectives and pathology. Okay, you need to write these traits, and in each stage what is the most important character that will be based on the erogenous zone in that stage. For example, in oral stage, the erogenous zone is the mouth, okay, or the oral cavity. So all the learning that is acquired will be around the oral cavity. So you need to highlight that stage. Now what is the objective of the stage, or the main event of that stage has to be written, and if this stage goes wrong, okay, what can be the pathology that develops, okay, that is what is the maladaptive behavior that develops if that stage goes wrong. So that has to be written. Now under the phallic stage, if you see, you will see terms like Oedipus complex and Electra complex. Both these are being asked as short questions. So whenever you write this answer, write that it is based on the phallic stage of Sigmund Freud's theory. And these two terms, that is castration anxiety and penis envy, these have to be highlighted when you write answers on Oedipus complex and Electra complex. Okay. Now, psychosocial theory by Erikson Uh, Again, it is divided into stages. If you want, there are even comparisons given between Sigmund Freud stage and Erikson stage in Shobha Tunnel. But these stages have to be memorized and written correctly. First, this table has to be drawn, and then you can just elaborate on these terms. That is, for example, the basic character in first in year of life is hope. Okay, that is the child. If the child's needs are met timely, the child will develop a basic trust in the world and will consider that the world is a safe place. So likewise, you have to elaborate on each term that is written, and this have to be memorized very well. That is the Erikson's theory. Now next is the cognitive theory by Jean Piaget, and again the key terms in this theory are assimilation. See, this theory is nothing but the process of learning. So this forms the basis of the education system. So you assimilate information. Now when you assimilate information, you accommodate it. That is, you form schemas. It's called schemas based on the previous information the person has. The new information is connected to those informations, and then you reach to a state of equilibrium. Okay, based on the new thoughts and the previous thoughts, you form a conclusion and reach to a state of equilibrium. That is called as equilibration. Now, the sequence of development in this stage is sensory motor, pre-operational, concrete operational, and formal operational stage. Now, what are the key events happening during this stage? For example, in the sensory motor stage, it is object permanence. Okay. Pre-operational stage is symbolic thought. Concrete operational, that will be based on the ear. That is, that the child can now form operational thoughts, and formal operational thoughts means the child can now start understanding abstract concepts. So this theory basically forms the foundation of the education system. Okay, so you need to highlight that. Now next is the classical conditioning theory by Pavlov. So you need to draw this diagram symbolically. That is, when there was an unconditional stimulus, there was an unconditional response. That is, food brings about salivation. Now if there is only bell, there is no response because the dog is not conditioned for it. Now when you introduce both the food and the bell together, next time what you get is a conditioned response and a conditioned stimulus. Okay, so that is, this diagram is enough to fetch you marks, and the examiner knows that you actually know the content of this theory. Okay, and that is a smart way of saving time while writing answers. Now, operant conditioning, this will be again based on the positive and negative reinforcement that we practice in behavior management. So draw the state diagram, that is, what is positive punishment, what is positive reinforcement. Positive punishment is adding something to decrease behavior. Negative, now you can give examples of each of these when you write. For example, negative punishment is subtracting something to decrease behavior. For example, if the parent's presence in the operatory is, encouraging the child to throw tantrums. Some children will throw more tantrums in the presence of their parents, whereas some children will calm down in the presence of the parents. So, encouraging the parents to stay in the operatory or asking them to leave the dental clinic is going to help you for your behavior. That is what this will determine. Now next is the social learning theory by Bandura. What this theory simply means is that a person learns by observation. Okay, and that will depend upon the environmental factors, that will depend upon the personal factors, but this learning may or may not change the person's behavior. So that is what social learning theory says. Now the key terms will be antecedent determinants, that is the previous acquired knowledge, how it is going to influence a person's behavior, and what are the consequent determinants, and modeling, that is live models. For example, in a operatory, the presence of a sibling can be a method of modeling. So if the sibling is sitting and being a cooperative patient, the younger child might see that and learn, okay, and change his behavior if he was apprehensive earlier, and that leads to self-regulation. So again, these terms: antecedent determinants, consequent determinants, modeling, and self-regulation. Now, the stimuli acts as, that grabs your attention, you retain that stimuli, you lead to motor reproduction and motivation. Now, hierarchy of needs means these are the 5 categories of human needs that dictate a behavior. So that starts from the physiological needs: safety, love and belonging, esteem, and self-actualization. Try to draw this diagram because this is the summary of the entire theory. You just need to elaborate on these points. Okay. Now, Maller's theory, it includes normal autistic phase, normal symbiotic phase, and separation individualization phase, which will again depend upon the age of the child. For example, in the autistic phase, it is just a half awake stage. Okay, it is just the major task is just to be in equilibrium with the environment. So that is birth to 4 weeks. Then symbiotic phase, the child starts giving a social smile. Okay. And in separation individualization phase, there are these 4 stages, that is differentiation, practicing, rapprochement, and object consistency. Now, next very important topic is behavioral science and its application in pediatric dentistry, and these are the questions that have come in previous year's question papers. Again, what each method of behavior management can be a short note, and this can also be a long answer question: the pharmacological and the non-pharmacological methods. So again, I have picked this up from Shobha Tandon, that is classification of child's behavior. Whenever you start writing this answer, start with the definition of behavior and the different classification given by different authors. Now, you can be asked, define stoic behavior. So you need to know what the terms given by these authors mean, because they have come as small definitions. Okay, define stoic behavior, what is defiant behavior. So you need to know what these terms mean. Okay, and then the basic methods of behavior management. Now, type of parenting styles is another question, and maternal influence in the operatory is another question. So, type of parenting styles is given in Shobha Tandon, that is 4 types: permissive, authoritative, neglectful, and authoritarian. The maternal influence is just slightly different, and this is better given in Nikhil Marva, that is overprotective, overindulgent, under-affectionate, rejecting, and authoritarian. Now, behavior management, if you get a long question on behavior management, write these terms: behavior management, define these terms: behavior management, behavior guidance, behavior shaping, and behavior modification. The classification in Nikhil Marva is more accepted than the one that is given in Shobha Tandon, that is psychological approach, physical approach, and pharmacological approach. Now, coming on to the methods, it can be communication, that is verbal or non-verbal, and how to communicate. You can give examples of reframing and euphemism that are used. Now, behavior modification. See, you can be asked, write a short note on desensitization. Desensitization means nothing, it is just the tell, show, do technique. Write the name of the author, that is, it was given by Adelston. A brief introduction about it, that it is a method of behavior modification, and indications of that method, in what age group you can use that method, and the application, that is how you do it. Give an example of that. For example, how do you desensitize the child when you're using an erotor? Okay, so that is what is about tell, show, do. Now, modeling, always start that it was given by Albert Bandura, and these are the methods of modeling, that is live model, it can be parents or siblings, films, models, posters, and audiovisual aids. Now, contingency management is again based on the operant conditioning theory given by Skinner, and that is based on the positive and negative reinforcers. You can draw that same diagram in this and give examples. Now, next is behavior guidance. So these are the terms, that is distraction, biofeedback. Write these terms and give one example for each, and that will be enough for you to elaborate in a long answer question. biofeedback, humor, coping, voice control, relaxation, hypnosis, implosion therapy. Now, aversive conditioning has been a frequently asked question. So, just you may know what this, home technique means. You may know what physical restraint means. But when it comes under aversive conditioning, you need to write both. So, always terms are there. Now, physical restraint and protective stabilization. So, it can be active or passive, and when you write about the passive, there is one table given in Shobha, that is, you have different options for body, head, extremities, and mouth. Now, last is the pharmacological methods of behavior management. So, whenever you are asked about pharmacological methods, students tend to write only about conscious sedation and general anesthesia. But all these are the methods of pharmacological, come under pharmacological methods of behavior management. That is conscious sedation, minimal sedation, moderate, deep, procedural sedation, dissociative anesthesia, general anesthesia, and daycare or ambulatory anesthesia. So, you need to at least list down these terms and then start your answer. Now, each of these terms can be a short note. Okay, so you need to write about objectives, indication, contraindication, patient evaluation. Whenever you write patient evaluation, particularly if you write the ASA classification and Malampati score, it is very important. The documentation, that is before, during and after the procedure, what is the sedation protocol. Now, various agents that are used for sedation are given both in Shobha Tandon and Nikhil Marva. You can refer whichever book you have. And what are the medication and post-operative assessment. Now, when we come to nitrous oxide sedation, you need to write about the indications, the contraindication, what is the storage, that is especially the color of the nitrous oxide cylinder, that is blue, the color of oxygen cylinder is white. You can even draw diagrams like that. What are the properties? Okay. Describe the equipment, that is the sedation unit, the dental sedation unit. Also highlight about the fail-safe mechanism, that is practically you cannot administer nitrous oxide without administering oxygen, that is the fail-safe mechanism. Okay. Elaborate on the scavenging unit. All these terms tells the examiner that you know the answer. Okay, so you don't have to beat around the bush and you'll get more marks. Phases of administration, that is also given as a table in on page number 275. And diffusion hypoxia is another short note. So make a flow chart on the pathophysiology, that is high concentration of nitrous oxide. When it is discontinued, it raises the partial pressure, so the nitrous oxide rapidly gets transferred to the alveoli and leads to hypoxia. So this can be avoided if you give 100% nitrous oxide for the first few minutes, and after the procedure also you give 100% oxygen. Now, this is practically not possible in dental settings because the dental sedation units are such where you can give only 70% nitrous oxide. So, diffusion hypoxia is usually seen at high concentration of nitrous oxide, but giving 100% oxygen before and after the procedure has its own benefits. It helps the patient to come back to normalcy very soon than just discontinuing nitrous oxide. So all that you need to write when you get an answer on diffusion hypoxia. Now, what is the basic mechanism of action? That is, it brings about an analgesic effect. All that you need to write in mechanism of action and the phases of sedation. Okay. Again, the phases of sedation are given. That is, you need to check on the communication and the signs that the patient is giving based on which level of sedation the patient is. So, we need to stick on to conscious sedation. We don't want to slip on to deep sedation. So, all that you need to write when you get an answer on nitrous oxide sedation. So, I think I've covered all questions that have come from this topic. I hope you write the answers well and highlight the key terms, and all the best for your exam. Thank you.